Patients often come to see me in clinic for evaluation of what is referred to as a peripheral neuropathy. Broadly speaking, they will be describing symptoms such as maybe some numbness and tingling in the feet. There may be a burning sensation, some mild unsteadiness. Because I see this condition frequently and diagnose it frequently, I thought it would be useful to do a few videos explaining what a peripheral neuropathy is. And then because this channel is largely dedicated to exercise, I'm going to work with my physiotherapist to bring exercise videos that are specifically designed both for patients who have already been diagnosed with a peripheral neuropathy and for those who have been diagnosed with a condition that may increase their risk of developing a peripheral neuropathy. So before delving into this, I'm going to just briefly describe what the peripheral nerves are and what they do. So peripheral, first of all, means the nerves that are essentially in the arms and legs. They're broadly divided into large fibres and small fibres, and with the small fibres you have two types. You have autonomic fibres that are involved in the control of something like sweating function, and then you have small sensory fibres which are involved in the perception of pain and temperature. Then you have the larger fibres, and they are divided into large sensory fibres and large motor fibres. So the large sensory fibres are responsible for what's called joint position sense and balance. So you know where your arm or leg is without necessarily looking at it, and we call that joint position sense or proprioception, and the large sensory fibres play a role in this. Then you have large motor fibres, which are involved in putting a thought of movement into action, so is responsible for the movement of our muscles. So at a brain level, all of this is then coordinated. So for example, when you're walking, you have certain muscles flexing, certain muscles extending, certain muscles are stabilizing the pelvis, and all of that is happening without you obviously giving it any particular thought. And at the same time, the sensory fibres are sending signals up to the brain about what it is feeling underneath the feet. Finally, I'm just going to explain what nerve fibres are. So nerve fibres are called axons, and the axons are grouped together into what are called fascicles, and then within a nerve you have a group of fascicles destined for certain muscles. And the larger fibres that I was talking about, like the large sensory and motor fibres, are also covered in an insulation layer that's called a myelin sheath, and that just allows the nerves to conduct their information at a much faster rate. So that's just a brief overview of peripheral nerves and what they do.